Hello, everyone, and welcome back to a D4H live stream. My name is Billy Pappas, or Billy P today. I am the Emergency Management Solution Specialist here at D4H. And today on this live stream, we're going to be talking to Adam Perper from St. Joseph's Health, one of our great healthcare clients here at D4H. While you're watching this live stream, of course, we're going to go through questions and review the software. But you got any questions, any comments, anything you want to add, feel free to drop it in the chat and we'll address those questions as we go along. So with that, I guess I'll bring Adam in and we'll get started. Adam, thank you so much for joining us today. And if you want to give a little bit of an intro about yourself, your role, and a little bit about St. Joseph's Health.
Sure. Good afternoon, everybody. So my name is Adam Perper. I'm the Director of Emergency Preparedness at St. Joseph's Health. I've been in my role just over a year at the current time. I've been in emergency management for well over 2 decades. And using D4H and what we're going to discuss today has been an instrumental part for our organization in streamlining a lot of our processes with emergency management.
Yeah, and I'm looking forward to seeing all the work that you do in the software. It definitely looks a lot prettier than the demos that I give for the company. But I guess we'll start a little bit about the background of your organization and kind of the processes, because we want to build the context as to why you're using D4H and kind of how it's actually helping you day to day. So I guess we'll kind of start, the main responsibilities of your emergency management team in healthcare. Emergency management varies from different sectors. So if you want to walk me through a little bit, the primary roles, responsibilities, and just some really basic procedures on how you would address an emergency with your agency.
Sure. So to give some context about St. Joe's, we are a healthcare system. Our primary hospital is located in Paterson, New Jersey, a level 2 trauma center, which sees a lot of different things throughout the community that comes into our hospital. We also have an additional hospital in Wayne, New Jersey. And then we have an ambulatory care center in Totowa, New Jersey, as well as a conglomerate of offsite practices ranging in the number of 98 offsite practices. So there's a lot of bring everything together and having the coordination. And that is why when we were researching for the best platform for us, we ended here with the ability to be able to create what we need to coordinate all of that. The primary role of emergency management at St. Joseph's is to prepare and respond to any and all emergencies. And this is to primarily ensure the safety of not only our patients, but the staff and the community as a whole. Our department is busy developing plans, policies, conducting training, coordinating resources when needed, and making sure that we're integrating all this with the communication and ensuring the continuity of operations during any disruption to any of our facilities.
Yeah, and that's a lot going on from both the response aspect, but also managing people and also managing facilities. So there's a lot of facets for just, something as simplistic, supposedly, as healthcare, which really covers a lot of ground. But, before I get more into the coordination aspect, I guess kind of, what challenges might you be? I know you kind of preface it a little bit by all that you have to oversee as a healthcare agency, but is there anything in specific that maybe you had gaps or some sort of challenges before when you were kind of searching for D4H, what kind of led you to that solution and kind of how you're blending that solution, if that makes sense? I'm kind of tumbling over the question a little bit.
No, it's quite all right. So coming into this role, unfortunately, a lot hadn't been done in quite some time with our organization. Not just because of specifically the individuals in the role, it was more because we were just coming out of COVID. Everyone was busy and focused on COVID. So with that in mind, one of my primary focuses was to come in and look at the organization as a whole and see where we are starting from the ground up. We had to redevelop a lot of plans and policies. And the problem was, where do we keep all these things? My team, which I give a lot of thanks to on a daily basis, because one of the things was, how many assets do we have? How many whoosie watsits do we have in the closet? We had no tracking of any of these items. So this was another element to D4H to be able to track our assets. Aside from that, it was the ability to be able to manage an incident or an event from any location, one of these major locations that we have, or simply trying to monitor something from home if it's the middle of the night. And this gave us the opportunity to be able to do that from wherever, whenever, which was a huge lift for us.
Great. And I think that kind of covers the introductory part of what I was kind of hoping to kind of understand, establish the context, figure out the gaps, and now we bring in the golden solution of with D4H. What I'll kind of do is we transition to start sharing your screen. With technology, what kind of role does technology play for St. Joseph's Health? I mean, you were saying how you were analyzing a lot of different elements of healthcare, and obviously you have a software now that manages everything for you. But, how often do you collaborate, overlap? How's the communication? How's that kind of working with a new technological feature as we start to show people all your fun work and achievements with D4H?
Yeah, so it's funny that you bring that up because we had our emergency management committee meeting today. And one of the things that the overview of 2024 was the fact of communication was above and beyond what it's ever been in the past. Not just from a mass communication system wise, but the sharing of information. Our critical departments, like our trauma department, our emergency department, all knew what was going on in the community or what to expect. And that is thanks to my team constantly managing and monitoring things going on the outside and documenting it within a process via D4H to be able to have those people see the information or to tag them so they're notified immediately, which truly makes things a lot easier.
Yeah, I mean, you're speaking my language. You're doing my job for me in terms of, showing how well it works. But I guess we'll start, if you want to share your screen, we'll start walking through some elements and how you use it in your specific case study. And we'll just go from there. So I don't know if Amy on the back end, our marketing manager, wants to prep up that site. Great. So before we jump into specific incidents and exercises and all that good jazz of emergency management application, we'll start first with your tracking, because that was a really big deal from what you were explaining in terms of the initial phases of instituting technology for St. Joseph's Health. So let's start with your tracking. And if you want to walk me a little bit about the channel, what kind of elements you track, and then we can kind of dig further into some of the execution there.
Sure. So the first item that we have here is our OEM tracker. So for our department, and we are a three-person department, we are constantly tracking anything from incidents that are going on within the community. We are also tracking our after-action reports, our improvement plans. Currently with winter, we are tracking what are called code blue alerts. When the temperatures go below 32 degrees and some of our exterior or our stakeholders are opening up warming shelters. We also are assessing our other hospitals in the area, if they're on divert for any reason, if there's a specialty not available at another local hospital, could we see an influx to things of that nature? So that's what we've done in this dashboard here. And the nice thing is that we also track our meetings, we track our trainings, and this is just internal for our department at the current time. As you can see here, we keep track of all of our critical units and departments. So at the current time, 349 departments throughout all of our facilities. And what we've done is we've broken them up currently by where their location currently is. As you can see, a lot of locations, and we've broken them up into those divisions or groups and been able to put all the critical information for where they're located, contact information for their managers, their directors, for 24-hour numbers, God forbid something happens. Always accessible, because at 3 o'clock in the morning when you're trying to find a phone number in your cell phone and you haven't had it saved, you have another backup somewhere else to get that information.
Yeah, absolutely. And I also, I see a question there from Scott. Scott will address that in just 1 second. And welcome for joining the stream there. But Adam, I want to focus first too. You mentioned that you track all the meetings. So that was a really big thing that I talk a lot about with customers in our demos, is that, how do we track calls, communications, our meeting schedules, our meeting agendas. How do you execute that with St. Joseph's Health? I know that you just pulled up the dashboard there, so I'll let you talk through that a little bit.
Yeah, don't mind the first one. Chris from our office got married. We put it in as a meeting.
Congratulations, Chris. Why isn't he on the call?
He's in the background. But we're integrating things as we move forward with different things that we have from our IT department. Right now, manually, we're putting in meetings into here as well, keeping track of dates, times, locations, call-in information. If there's agendas or anything else that we can attach to it, we do that as well. This way, if we also show up in a meeting and we haven't printed out an agenda or anything else, we can still access it through D4H as well.
Gotcha. And have some of your colleagues found it difficult, although, because, one factor that we talk about is that D4H isn't we don't host videos, we don't host live conferencing, but I see there you posted your links and your meeting locations. How has that workflow been working out in the transition of this new technology for your agency?
So we put the links directly in here so that you can click on them and open them up on any of the browsers, or we are very Microsoft Teams heavy with our facility. So the integration to be able to open up Teams, whether on an iPad, a laptop, or anything else, we've had seamless integration with that.
Great. And what I'll do, which I do have some other specific questions here, but I do want to address Scott's question in the chat. Any integration or API to bring in data from New Jersey? So in general, D4H does have a completely open source API, but do you have any examples in this specific instance or experience with using the D4H API and external resources?
Yeah, unfortunately not yet. Scott, we are currently working and hopefully moving forward in Q1 with the New Jersey Hospital Association to be able to get that API to integrate directly into here in where the divert statuses and everything else would automatically appear in here.
Great. So if you don't mind also sharing, I'd like to actually dig a little bit into your situation report, if you're okay sharing that before we move forward. So one big thing with D4H is that we can always customize different elements and forms and situation templates. And so what kind of advantages have you found with having that customizability and tailorability with a lot of the forms for St. Joseph's Health?
So a lot of what we have done has been very customizable, which has been fantastic. Since Scott is on the call, I will definitely give him a shout out because we have called him and asked him quite a few questions and shared some of the extension packs that they have built and manipulated them to what is best for our institution. And we've also worked closely with RWJ, with Paul Makita, for some of his things that he's working on from the other side of the healthcare side of things. So emergency management is all about the integration, networking, and sharing of information. And that has been tremendous for those who have already started with this. But being able to adapt it to what our healthcare needs or our own institution needs are has been fantastic. So we have basically, as you can see on the screen, this is our situation report. It is basically similar to any of the situation reports that open up on any of our incidents or our plays, according to D4H. I still call them incidents to these days. But basically, any of these things can be created, adapted, changed on the fly. I truly rely on my team to be able to change things on the fly in the back end because I am not IT centric. But a lot of these things have worked seamlessly. Few tweaks here and there, but have worked great.
Great. Yeah. Thank you for walking through that. And before I get into more details, I do want to kind of switch gears to focus on some incident examples since, I'll pause also on the next screen that we go to with, and Nelson, I see your question there. I will actually, let's address that question first before we get into some of the incidents. Nelson G asked, is there any additional cost if one were to share customized solutions? An addition that was developed at St. Joseph's was being implemented in another facility while collaborating with them. I could spoil the answer, but I don't know, Adam, have you collaborated frequently with other agencies, and has it cost you any additional, funds to share that information or to kind of, customize those solutions between agencies?
So has not cost us a penny to be able to share those extension packs with any of the other organizations, whether in healthcare or outside of healthcare. So Nelson, if you need something, just get your checkbook ready because we'll take a little side piece for that.
It'll be off commission. But what I will add, Nelson, as well, obviously we have these phenomenal customized packs from our actual customers, such as St. Joe's or even Monmouth County from Scott Nielsen. But also on our website, we offer free extension packs as well. So you have a lot of different avenues to integrate a lot of information on your own software if you're interested in looking for D4H. But let's change gears here to some of the incidents. So Adam, I think we'll start with the CrowdStrike one first, if that's okay with you. And
Sure.
we'll kind of walk through a more live time response application. So when Adam and I were kind of prepping very briefly before this live stream, he was walking me through some of the past incidents that they've experienced, and CrowdStrike outage being one of the most notable ones. But I would also want to add, as a technological company, when you have an IT outage or some sort of outage, how do you manage that type of emergency with a software that's based on the internet? So Adam, I'll briefly toss it over to where do you want to walk me through a little bit this incident, how it was, created, how it was ran, just some highlights that you want to kind of give some additional context to.
Sure. So the team had created a play in advance for, IT disruption or IT downtime. So some of this stuff was built already. The nice thing is that you are able to build things, on the fly as things progress that you didn't think of or that somebody else might remind you of. With this incident, we lost all computer access to all of our laptops, our desktops. We had approximately, if I quoting correctly, about 5,000 machines that were no longer viable or being able to use at that current time. Some of the machines that weren't on the network that people had taken home the night before actually were not disrupted. But the nice thing is that we have other devices. So for the emergency management team, we do have iPads as backup. We have our cell phones, which again, you have the app through D4H to be able to do this from your cell phone as well. So there's not always a need to have the physical laptop. You do need to have some internet access to make things live, which we do have redundancy for as well. But CrowdStrike did not affect the internet with our facility during that time.
Great. And so I do want to focus on a few elements of the specific incident just to tie in both the D4H and your execution. So kind of what we were talking about before with the extension packs. I want to talk a little bit about checklists because I noticed that you have the HICS IRG integrated for the specific response. Do you want to talk a little bit about your management by objective style for St. Joe's and also how maybe you found this extension pack helpful for your own operations?
Sure. So we had taken the HICS template that was provided and built out from there additional responses that we may have from a healthcare institution. The nice thing is with HICS is that it is adaptable and you can change things based on your own institution or what your leadership or your executives might want. So we do have a lot of things that are pre-populated. And the nice thing is that you can assign them to those specific roles, whether they are your command staff or anybody else or operations. You can assign them so when they log on, they would be alerted that these are the tasks or these are the things that need to be completed sooner than later. It is really nice and easy to be able just to, click on a box and say it's completed. Here you can put in notes if you need to put any additional notations that you completed or how it was completed. But a lot of these things were, easily to be able to use in the beginning, and we just adapted them to our organization as a whole.
Great. And if you don't mind me asking a little bit too about the transition to using these digital objectives, what was St. Joe's using before D4H in terms of management by objectives? That's a big transition for an agency to go from maybe paper and pen or another software into something such as this. I don't know if that's something you can speak to as well.
Sure. No. Our emergency operations center used to have the 38 binders on the in the closet or on the shelf that, you had to dust off when you came in to activate, had multiple copies of all the specific forms that they would be using with all your pens, papers, markers, crayons, and whatever else. Our incident management team this year has transitioned very nicely with the use of this. The team has done multiple tabletop exercises, as well as training evolutions with the team to make sure that they are comfortable using the tools that are provided within the system.
Great. That's great to hear too, because we are the uncomplicated software for emergency management. So that's great to hear that the transition was pretty seamless and easy. The next element that I do want to focus on here. So down on your status boards, I see resource requests. I don't know if that's populated. No stress if you want to not share anything for that. But I did want to focus on that kind of workflow because I am asked a lot in my demos. How do you do resource requests? How do you make sure someone signs off on something and toss it off to another person with a proper notification? Do you want to walk me through your agency's resource request operations and kind of how you execute that in D4H?
Sure. So we had taken some of the templates originally from RWJ, Robert Wood Johnson, again, adapted them to our organization and what we needed based on, what our true resources would be that could or would be requested. During this specific incident with CrowdStrike, we were trying to document and not keeping it in a log or on pen and paper. We kept it here to log all the different locations that were affected. Again, not every computer throughout the entire system was affected, but we have desktop, we have wows and cows, we have laptops, we have a slew of things. We actually had doctors' offices or exam rooms that people didn't know there were computers in. So we literally had to send a strike team out with one of the directors from that specific unit to walk them room to room to room. And basically we were able to input those requests directly in here and manage them and get feedback from them once that request was satisfied, and then being able to mark it complete, which was nice to be able to track those, those completions of the resource requests here versus the Post-it note, the napkin, and anything else of the old way of how we used to do things.
Right, absolutely. And so we'll address Nelson's question in the chat here. And Adam, feel free to answer it if you'd like to go for it. Would any forms or documents brought into D4H be available if the networks were rendered unavailable? I don't know if Adam, you experienced this specifically with your exercise, but I'll let you address it first before I give the software answer from my end.
We have not had any IT downtime involving the internet access. So I am unable to answer that question, and I will turf it back.
That is okay. That's why I'm here. No, so so Nelson, yes. So as long as you have the incident actually created and populated, you can use the content in the incident itself to enter in information. So you can use the forms, just it's not going to be live time. It'll have a delay in terms of uploading once you restore that connection. So short answer, yes. Long answer, just got the incident created, and then you can use it as if it's offline. We actually have a customer case study on our website if you want to learn more about that. But so with this remaining incident here, Adam, I don't know if there's anything more specific you'd like to highlight that you think might be a little bit more unique to your approach in this specific incident. And if not, we can transition into the next one that we had queued up for the live stream today.
With this incident and with most of ours, we make sure that our incident management team has all of their tools at their fingertips. To give you an example, websites, right? We have all of our websites to all of our stakeholders, and this really is being used by our marketing and our PR department to be able to make sure that we are streamlining the same message that's going out, whether it's from the local, from the county, or from the state, that we are doing the same thing. So our PR person who's on our incident management team would, check these sites. Most of them they already have saved on their own laptops and computers. But if somebody were to fill in on that role, they'd be able to see what's going on as well.
If you don't mind me also focusing a little bit more on a point that you just brought up. So another big item that has brought a lot of attention when people are looking at our software is how do they communicate with the greater state or the federal level? Because, not every agency is going to be using D4H. So when you mentioned about the coordination of speaking with the state or the federal level, how does St. Joe's use D4H to communicate and share that information with those individuals that may not have access to D4H?
So the nice thing with D4H is that some of your local, state, or federal partners could have an account and be logging into an event, which we can invite them to if there's a specific individual. The other nice thing is that we can send a live link to them, and they can monitor truly bit by bit of what's going into our sit rep and be able to monitor that remotely and not even need an account within our own St. Joe's account, which is truly nice because we have shared information with the New Jersey EMS Task Force and other partners. And this was a great opportunity to just be able to send a link in an email, and they're able to log in and see what's going on.
Great. Sweet. Yeah, so let's switch over to the next incident now, just because this is, it has to do with mass casualty and people, not so much a technological impact, and you're healthcare based after all. But so again, before we jump into the specifics, do you want to give a little bit of context about the mass casualty incident and a little bit more about this channel before we jump into some other technical capabilities?
Sure. So we ran 2 full-scale exercises this year, one at our Patterson campus in September of 2024, running a second exercise at our Wayne campus in October of 2024. The incident management team during the Patterson exercise was still doing the old way of pen, paper, filling out forms. And our goal was to have the D4H for us up and running and fully accessible by Q4 of 2024. We met our goal, and during this exercise is when we rolled this out to the IMT for the first time. They did have some training prior to, but didn't really get to use it in a full-fledged event or incident prior to this. So we rolled this out for that exercise, and they were able to run the entire incident from this platform. And they actually did share the link with some of our stakeholders that were in the EOC with us that do not currently have access to our account.
Great. And so what I do want to focus on with this specific example is a little bit more on the people aspect. So I'll start first, although I know that you're more of the grander emergency management rather than the, ER techs, the doctors, being actually in the ER of a mass casualty. Mm-hmm. But how does your software, not your software, our software, D4H, how are you able to manage people and patients? I do want to focus on the EOC staffing, but a little bit more on, I want to kind of mold into the context of almost evacuations or sheltering or tracking people or tracking patients or tracking ambulances. I don't know if you can speak a little bit to that with this exercise throughout that occurrence.
Yeah, so with this, a lot of it was used through our logs. And the nice thing with our logs is that you can tag additional people so that it alerts on their cell phone or their computer if they have the desktop alerting on, and being able to share that information and confirming the information, because a lot of time you get the misinformation of what's going on. So to give you an example, in our log, you can see, I will scroll back up to the top so you can see everything that went on. Quite a few things here. But you can see in the beginning the availability of beds, the bed status of the hospital. With that in mind, to one of the questions that were asked earlier, we are going to be working on an API with our bed management system through Cerner so that it can feed accurate numbers directly into our system of what's available, what's not, how many holds in the emergency departments we currently have. And that's what we're working on for the upcoming year in 2025. But the nice thing is that, any of these different things, as you can see, they're tagging people. So this one was our public information officer. They were considering posting something, which you can see at 10:51, and they tagged the incident commander down here, which he got alerted on his device and was able to go back and review what it was and approve or deny the posting of this for, social media, our website, and everything else. This has been a phenomenal tool for everybody, specifically currently with the IV fluid shortage. What we're doing on a daily basis in putting in our updated numbers or updates from the New Jersey Hospital Association or anyone else, we are able to input this and tag those critical people like our chief medical officer, our chief nursing officer, our executive director of logistics. They all get the updated information immediately once we tag them in any post within the log.
That's great. It's great that you can integrate multiple levels of the entire response also in one central location, which is, of course, the point of D4H. The other aspect I wanted to focus on in terms of people, so I see the EOC staffing status board. How do you track, your EOC staff, or, do you manage it with shifts, or maybe this isn't, I didn't know it was
Yeah,
not populated, but, if you want to walk me through the process of kind of how you track your staff and EOC staffing from an operational perspective as well.
sure. So our incident management team is comprised of a multitude of different directors or managers. They are in their specific roles based on not only their daily operations, but also their experience in working in the emergency operations center. When they come in, they all log in. The nice thing is that we can truly see everyone who's physically online at any point in time. This, as you can see, is all the personnel that were invited to this event, most of them being all directors and executives and our incident management team. To point out here, you can see everyone most of the people have a gray dot. The gray dot being that they are not currently online, green being that they're online. The nice thing for us is that we can see who has been logging in and who has not when we ask them if they've gotten some insight into the platform. But we are still working on assigning specific roles and categorization of these individuals within our platform.
Great. Yeah, no, that's awesome. And I saw that Robin dropped a comment. So our CEO, Robin Blandford, is in the chat. So if anyone wants to shout out Robin, he's also there. But so Adam, we've talked about equipment, we've talked about information, we've talked about people. The last little bit I want to talk about before we kind of go into some future discussion, you were talking to me earlier about in 2025 having kind of like not like a daily channel, but a weekly kind of huddle channel or some sort of orchestration of repetition for your operations. I don't know if you want to walk me a little bit about that concept and how you're kind of mapping out D4H to fit those needs.
Sure. So it's labeled as a weekly AOD, Administrator on Duty Safety Huddle. Every morning, we have a safety huddle with all of the directors and the executives throughout all of our facilities. Currently, in the process of how it's completed, the team prints out a form, they handwrite the form, they would fill it out, scan it, put it into a network drive. Form was the ability to put that form on here and make available that they can fill it out literally on the fly as they are doing their safety huddle and filling in all the critical information that they might have based on those specific departments. We did put check boxes in for nothing to report because a lot of people usually don't have much to say. But the nice thing is that if we have something critical, we also have the ability to tag someone physically on that item so that they get alerted if there is something critical or a follow-up that is required by another department or that department specifically. Again, this was not something that came with D4H. And I will give a shout out to Chris, has built this from scratch and been able to adapt it. We actually ran a test. I was the administrator on duty during Thanksgiving. And when I did the reports, we did it through here and was able to present it to the administration with, they love the way it looks, few minor tweaks here and there, but hopefully in 2025, we'll be rolling this out to be able to use for all of our daily safety huddles.
Great. And I do just want to, pry a little bit with 1 being the easiest, 10 being the most difficult thing you've ever came across in your life. How easy was it to kind of recreate this form in the software? I know that Chris did the work there, but from your experience in using the software as well, how do you kind of rate it on a scale of 1 to 10 in terms of easiness? And you can be honest, don't worry, we won't take anything personally.
No, it's quite he's on the other side of the room going 4, 5. It truly was not a horrible lift from him to build this. It was done within an hour or two. There was a lot of manipulation from our side to make sure that we are incorporating everything because not everyone states the same thing every day. So we had to make sure there were enough boxes or that there was the critical information that they were going to discuss. Like, as you can see here, every day they give us a total census. They always give us the ED holds. So we had to make sure the critical information that they give every day was absolutely in here so that people who are non-clinical, who may be the administrator doing this call, could put the information, whether it's a number or it's a unit, quickly on the fly instead of them trying to figure out, oh, I got to write all this stuff down.
Yeah, absolutely. And I do the same thing when I'm building out forms inside of sports for a demo. It's a lot of trial and error as well, but the no code is also pretty smooth. So what I'll focus on next, since we reviewed a lot of these different incidents, just kind of some closing questions, some thoughts, and just your thoughts about D4H in general. So I guess I'll start first with, some of the features of D4H from your experience. What specific features or functionalities, and I know that you highlighted a bunch in our live stream today, but which ones do you find the most valuable, and which one has kind of been your favorite to use? And it's okay if you can't choose one, or if it's a tie between, a few.
No, honestly, the ease and use of the system from out the gate was tremendous. We did have some learning curves like anyone would have with a new tool. But overall, being able to bring in the plays, being able to create them, being able to adapt them to our everyday uses has been tremendous. And, we're able to make new dashboards if we have a to-do or, something new to monitor. It's done and built within a couple hours. It doesn't take days to do this. And being able to do that on the fly has been tremendous for us.
Great. So the next question that I'll ask, which also brings in some honest critiques about our software as well, what have been kind of your most common lessons learned with the software, whether it's agency related or something you wish to see in the software, or some other sort of operational lesson that has kind of came to light because of your use of D4H?
I'd like to have more knowledge in the IT background for coding. There was some things there that way beyond my pay grade, turf to my team to be able to do. That was the only tough thing for me, truly. For us as an organization, sending invites for people to register, unfortunately, in this day and age, some people thought it was spam, so they wouldn't accept it. Their invitation would go stagnant, and then we'd have to resend a bunch of alerts or invites. But overall, it has been seamless other than coding. I do not like coding.
Yeah, I get that. Although I will say I'm a big coder myself. I have a coffee mug that has an Excel logo and it says "Freak in the Sheets" because of Excel. I love Excel and coding. Great. Well, I got two more questions just to kind of ask about the future. So first, I'll focus on St. Joe's, and just I guess if you want to speak to emergency management. In general, whether it's healthcare related or generically about emergency management, but with or without D4H, where do you see the future of kind of your agency evolving, with D4H or without it, and just kind of the field in general, and how that software might help to kind of push you into those next evolutions? Because I know that you have some plans for next year for the software already.
Yeah. So aside from our administrator on duty, that team having access and doing their reporting, we're also going to be rolling this out in Q1 of 2025 for our executive leadership for their executive rounding on the specific units that they're touching, people that they're talking to, having the critical information of where all these units are located, their critical phone numbers for 24/7 access, God forbid something happens. Those are some of the big things. The other big project for us that we will be starting next week, which the team is not happy about, is we are doing asset tagging of all of our assets, importing them all into D4H on the equipment side, which I cannot show you because it's not built yet. But we will be inventorying everything at all of our campuses. Everything will be getting QR codes. This way we can track them. When someone needs an asset and needs to borrow the Who's Watts It or the flux capacitor, we're able to tag it out, give it to somebody, and be able to tag it back in and know that it's back in our possession, it was brought back in working condition, or if it needs PM. Those are the workings for Q1 of 2025 as well.
Great. Yeah, and that's going to be quite the meticulous process, I can only imagine. But what I'll ask is my last question, with your experience and your use of D4H, what advice would you give to healthcare organizations that might be looking for software, might be implementing our solutions or other solutions, just in general, the integration of technology, healthcare, and emergency management?
Yeah, the tool as a whole overall has been fantastic for, again, the coordination for any of our departments, the organization as a whole, but unit to unit, department by department, and being able to keep all of these things in one centralized location. Our administration has seen, not only from our events or our incidents, these exercises, what the tool can do, that we're branching out and using it for a multitude of other things. Like we discussed earlier, I think once we start getting some of the APIs built in and having more information, the centralized location of all of this in one platform is going to be tremendous for us.
Great. And then I do see one question from Robin, unrelated to the software, and then we got Petrus also on the call from New Zealand, I believe, as well. What kit do you keep in the Peli boxes behind you? Is it
So the yellow boxes that you see are lights. The boxes below them are portable batteries, basically, that we can plug multiple devices in, like a portable little generator.
Great. Well, I mean, there's your answer, Robin, and Petrus as well. Petrus, thanks for joining us from New Zealand as well. But so that's all I got prepared. I mean, I think it was a pretty fruitful discussion as well. Adam, thank you so much again for coming on the live stream and showing everyone the amount of incredible success you have executed with D4H, and for being such a great customer to our company as well. But I mean, thank you again. That's all I got. And what we'll do is we'll just kind of close out the live stream, as there doesn't seem to be any other questions except for just Robin being a bit rambunctious in the chat, but that's okay because he owns the company. But yeah, thank you so much, Adam. So I greatly appreciate it.
Thank you so much. Greatly appreciate it. And we're looking forward to what 2025 brings for us with D4H and everything else that it has to offer.
Great. Thank you all so much again. And happy holidays to everyone on the stream. And we'll be back again soon with another live stream.